Hello, everyone. Last section, we talk about the classification of ILD. So this part, we are talking about the pathogenesis of ILD. The pathogenesis of ILD is not very clear right now. Several mechanisms are known to be involved in the pathogenesis and the progression of all fibrosing ILD. All ILD are believed to be triggered by repetitive chronic epithelial or vascular injuries or by granulomatous inflammation, which leads to cell destruction and, in case of fibrotic disease, to unregulated repair. For the Part A, so you can see several environmental and microbial exposure damaged epithelial cell with FASL or reactive oxygen species, which reduced epithelial cell apoptosis and activation and release cytokines, inflammation factors. So in the step 2, step B, damage of epithelial cells accompanied by the damage of the basement membrane. Epithelial activation releases more pro-fibrotic mediators, including transforming growth factor beta-1, that is TGF-beta-1, and TNF-alpha, tumor increases factor alpha, or platelet-derived growth factor PDGF, and anti-inflammation cytokines decrease, such as tissue factor PA1, PAN2, resulting the resident interstitial fibroblasts proliferate and migrate, matrix metalloproteinase increased, and basement membrane disruption. For the step C, fibroblasts are recruited from resident fibroblasts, circulating fibrocytes and epithelial cells, and fibrocytes undergoing EMT, that is epithelial mesenchymal transition. So growth factors are released by the damaged epithelium and endothelium, and the leukocytes are recruited. Mononuclear cells and T cells relieve pro-fibrotic mediators, TIMP1, and the overaction of fibrosis. For the step D, ultimately, MMPS and TMPS imbalance, and re-epithelialization, fibroblasts are activated to become myofibroblasts, which secrete excessive amounts of extracellular matrix, resulting in increased tissue stiffness and loss of function of the alveolar. So many factors are related to the ILD. For one is age, and another is exposure to occupational and environmental toxins, and gastroesophageal reflux disease, smoking, radiation, and chemotherapy is harmful for the lung. So for the age, between the age of 20 and 40 years, sarcoidosis, eosinophilic granuloma, collagen vascular disease-associated ILD, and familial forms of idiopathic pulmonary fibrosis are more likely to occur. And above the age of 50 years, IPF must be considered. For most other etiologies of ILD, there are no age or gender consideration above this age. So for the genders, so most of the other etiology of ILD, there are no gender consideration, but there are few exceptions. Women are somewhat more likely to have collagen vascular disease-associated ILD and LAM, and tuberous sclerosis associated ILD are excessively seen in women. So men are more likely to have pneumoconiosis. although asbestosis and berylliosis have been reported to cause bystander pneumoconiosis in wives and children of workers who are exposed to contaminated clothing. For the environmental exposure, a significantly increased risk has been observed after exposure to metal dust such as brass, lead, and steel, and wood dust. Farming, raising birds, hairdressing, stone cutting, polishing, and exposure to leafstones and to vegetable dusting, animal dust has also been associated with ILD. For gastroesophageal reflux, for abnormal acid gastroesophageal reflux, we call GER, through its presumed association with microaspiration, is a risk factor for ILD. Abnormal GER is common in patients with IPF, and GER is clinically silent in the majority of patients with ILD. And the typical symptom is heartburns and regurgitation. So GER is frequent in the normal population as well as in patients with other advanced lung disease, such as lung fibrosis associated scleroderma, and smoking. So some forms of interstitial lung disease are more likely to occur in people with a history of smoking. Active smoking may make the condition worse, especially if there is associated emphysema. Smoking is strongly associated with IPF, particularly for individuals with a smoking history of more than 20 packet years. For the radiation and the chemotherapy, having radiation treatment to the lung or using some chemotherapy drugs, example for lung cancer treatment, make it more likely to develop lung fibrosis. So overall, all of these factors could relate it to the happening of ILD. So next part, we will talk about diagnosis of ILD. So see you later.